Hello, lovely people. Today I'm going to give us a nice expose on endometriosis. Endometriosis is when there's implantation of womb tissue anywhere outside of the normal womb. So, for example, it can be implanted in the body of the womb itself, outside the womb, in the tubes, in the ovaries or eggs. Sometimes it can go into the abdomen, to the liver, to the spleen, as far as the nose, the mouth, the brain. So there is no part of the body that can hide from the womb tissue when it decides to spread. Science has looked for many causes of what brings about this phenomenon. Some suspect that when there is menstruation, sometimes the blood can flow backward, and this can cause the womb tissue to go along with it and get implanted in various parts of the body. Some also postulate or assume that it could probably be that the womb tissue travels through blood or other similar channels and moves to all parts of the body. The last theory I realized was that the womb tissue is actually not moved to different parts of the body, but the tissue in those individual areas undergo changes due to certain hormonal influences and certain body changes, and they change from whatever tissue they are into womb tissue. Unfortunately, science cannot yet agree on which is which. So currently, we do not have one complete cause of endometriosis. What we do know, however, is that endometriosis is a very common cause of chronic lower abdominal pain, long-term pain over years, months, that makes women very uncomfortable. In addition to this, it's a very common cause of infertility and is very underdiagnosed in the world currently. What makes you know that you have endometriosis? Usually, it comes with severe menstrual pain that is way more than usual. But maybe you do not know if your menstrual pain is way more than usual. So, how do you know? Let's go to the hospital and do a check. Apart from this, there could be cyclical pain depending on where the womb tissue has been implanted. If the womb tissue was implanted in the nostrils, it can come with pain in the nostrils around the time of menses. If the womb tissue is in the breast, it can come with pain in the breasts around the time of menses. Again, the womb tissue, which has been implanted in the various several areas, can also bleed during the time of menses. So this can present with bleeding in stools, bleeding from the nostrils, bleeding in vomiting, bleeding in cough, especially during the time of menses, or pain in these areas. This makes endometriosis a very uncomfortable disease, and coupled with how it can cause infertility and difficulty gaining childbirth, it gives a lot of anxiety, a lot of stress, a lot of depression, especially to our younger ladies. Endometriosis is especially common in individuals who have early menses, who have shorter menses less than 27 days, who haven't yet given birth, and also individuals whose sister or mothers have or have had endometriosis. What do we do if you have endometriosis? There are medications available, even though they are not always effective. Medications help to reduce the symptoms in sometimes up to 90% of people. These medications are usually hormonal pills that help to regulate the hormones and reduce menstruation. So they sometimes induce a form of menopause in the ovaries for several months in order to control the pain. Medications may be good in controlling symptoms, but unfortunately, they do not help to improve fertility. If you are thinking of fertility in regards to endometriosis, most likely the only option available to you will be surgery. Surgery is done using very interesting tools called laparoscopic tools. Now, these are tools that are made up of cameras and surgical tools, and they are introduced into the abdomen or whichever part of the body you want to examine through small, tiny holes in the human body. When these tools are introduced, They literally go to the place where the endometriotic tissue or the womb tissue is located, and then they surgically cut it out. Sometimes, unfortunately, the womb tissue may be implanted in certain areas that may be difficult for these tools to reach. This may lead to surgeries being called off, or may lead to more complicated surgeries, or even surgery may be deferred if we realize that the risk of having a surgery outweighs the benefit you will get from getting these tissues taken out. Endometriosis is a truly disturbing and debilitating disease. So, if you know anyone who has recurrent pain, which is very severe, especially during her menses, either in her breasts, in her brain, in her nostrils, in her abdomen, let the person see a medical professional and let's find out if it's endometriosis. Endometriosis is very underdiagnosed, but there's help available. See your medical doctor, describe your symptoms, and let's get help for you. Thank you.